Welcome back, everybody, to your personalized deep dive into today's top healthcare headlines. We've gone ahead and sorted through all the noise to bring you the most fascinating and relevant stories impacting the healthcare landscape. So today's deep dive focuses on three key areas: the evolving role of AI, the financial currents shaping healthcare decisions, and then also some compelling stories on the ground about patient care and access.
Sounds good. Let's kick things off with AI. It's pretty clear that it's more than just a buzzword at this point. It's really becoming deeply embedded into the fabric of healthcare.
Absolutely. I think the fact that physician adoption of AI has nearly doubled in the past year, now at a striking 66%, really underscores that point. It's no longer a question of if AI will transform healthcare, it's really a question of how.
Yeah, and what's really interesting here is the global dimension of this whole shift. Europe is actively trying to position itself as a leader in the AI race, alongside the US and China, of course. But this suggests that the implications of AIs in healthcare are going to be felt worldwide.
Right? It makes you wonder what the healthcare landscape will actually look like in 5, 10 years. Will we see a future where AI is seamlessly integrated into every aspect of care, from diagnosis to treatment?
It's certainly a possibility, but as with any powerful technology, there are some pretty essential questions about responsible implementation. Concerns about data security and storage and the cost of implementing AI tools are still very real.
Yeah, and I'm seeing some pushback on the regulatory front as well. Former FDA head Scott Gottlieb is advocating for lighter regulations on certain AI tools, particularly clinical decision support software. He argues that excessive regulation could actually stifle innovation, but then others are cautioning against moving too fast without fully understanding the potential risks.
It's a delicate balance for sure, and it's one that's going to have significant implications for both patients and providers. So, striking the right balance between fostering innovation and ensuring safety is going to be absolutely crucial.
Absolutely. Well, now let's shift gears a little bit and follow the money trail in healthcare. It's no secret that financial pressures are mounting in the industry, but some recent developments really raise serious questions about where priorities actually lie.
Yeah, a new study reveals that large healthcare companies are directing a significant portion of their profits to shareholders instead of reinvesting those funds back into patient care. So, this really raises some ethical questions about whether these companies are prioritizing financial gains over their core mission of providing quality healthcare.
Yeah, it's certainly a troubling trend, especially when you consider the struggles many hospitals face to just stay afloat and, the increasing burden of healthcare costs on patients.
And these financial pressures are playing out on a broader policy level as well. Republican lawmakers are targeting substantial cuts to Medicaid, and some states are already taking steps to scale back their programs. This could have a devastating impact on low-income individuals and families who rely on Medicaid for essential healthcare services.
Yeah, it's a double whammy for vulnerable populations, facing both potential cuts to safety net programs and a trend of large healthcare companies prioritizing shareholder profits.
And another financial pressure point is the surging demand for weight loss drugs, particularly the newer GLP-1 agonists. This demand is straining state budgets, with costs in some cases doubling every 6 months.
And that controversial Super Bowl ad for compounded GLP-1 drugs really threw fuel on the fire, sparking a pretty heated debate about drug costs and safety concerns.
It really did. The ad highlighted the complex dilemma surrounding access to potentially life-changing medications, while raising concerns about the safety and ethical marketing of compounded drugs.
Yeah, it's a multifaceted issue with no easy answers.
Definitely. Well, on that note, let's dive into some intriguing stories that shed light on the state of patient care and access across the country.
Okay, there's a story that really caught my eye about a small town in Florida going to extraordinary lengths to attract a family doctor. They're offering perks like free rent and equipment just to try to fill this crucial position. It really highlights the stark reality of the physician shortage, particularly in rural communities.
It really does. This story kind of underscores a larger systemic issue. If a town has to resort to those kinds of measures, it really makes you wonder what steps need to be taken at a policy level to address these disparities in access to care.
It's a stark reminder that access to healthcare is not equal across the board.
Yeah, and while some communities are struggling to attract physicians, others are exploring innovative ways to leverage technology to actually enhance care. Apple, for instance, has launched its first major health study in 5 years, exploring how its devices can be used to monitor and predict health changes. Users can opt in through the Apple Research app if they're interested in participating.
Interesting. It'll be interesting to see what they uncover. It seems like there's a constant push to harness technology to improve healthcare, but the key is to do so thoughtfully and responsibly.
Absolutely. And on that note, there's a fascinating initiative out of Tufts University and Kaiser Permanente that caught my attention. They've teamed up to launch a Food is Medicine program, which aims to integrate food-based interventions into healthcare.
Well, this is an interesting angle. Tell me more about how they're approaching this food as medicine concept.
Well, they're exploring a range of interventions, including medically tailored meals, produce prescriptions, and nutrition education. It's a recognition that nutrition plays a critical role in overall health and well-being, and it's encouraging to see this holistic approach gaining traction within the healthcare system.
It seems like there's a growing recognition that healthcare extends beyond pills and procedures, and that addressing the social determinants of health is vital for improving outcomes. This initiative really seems to embody that philosophy.
I think so too. It's a step in the right direction for sure. Yeah, it's fascinating to see how healthcare systems are exploring these diverse approaches to improve care and address challenges. We've seen towns resorting to unique incentives to attract physicians, and then we see large organizations partnering with tech giants to enhance patient care. Speaking of which, there's a compelling example of how technology is being utilized to actually streamline communication and collaboration among healthcare providers.
I'm always interested in innovations that can improve efficiency and coordination within healthcare systems. Which partnership are you referring to?
Novant Health has partnered with Microsoft to implement Microsoft Teams across their system. This integration aims to facilitate smoother communication and collaboration among their healthcare providers.
Makes sense. It makes you wonder if this kind of integration could help to mitigate some of the strain on healthcare professionals, particularly in light of the workforce shortages that we're seeing.
It's certainly a possibility. Enhanced communication and coordination could lead to improved workflows and potentially reduce some of the administrative burden on providers. Speaking of challenges facing the healthcare workforce, there's a concerning development regarding telehealth.
Oh, telehealth has become such a vital tool, especially in expanding access to care. What's happening on that front?
Well, the federal waivers that have been in place for telehealth programs, including the crucial hospital-at-home programs, are set to expire soon. This could have a significant impact on access to care, particularly for those in rural areas or with limited mobility.
This is a major concern. Telehealth has proven its value in expanding access to care, and letting these waivers expire would be a step backward. It's crucial that policymakers recognize the importance of maintaining these flexibilities within the healthcare system.
And the American Telemedicine Association is actively urging Congress and the White House to extend these waivers, arguing that allowing them to lapse would have detrimental effects on access to care.
If they listen, it would be a shame to lose the momentum gained in telehealth adoption during the pandemic.
For sure. Now, shifting gears to another critical component of the healthcare system, electronic health records, or EHRs. There's a notable trend emerging with 4 major hospital systems in the U.S. adopting Altera Digital Health's cloud-native EHR platform.
Cloud-native EHRs. I'm curious about the advantages of this approach compared to traditional EHR systems.
Well, cloud-native platforms offer several benefits, including greater flexibility and scalability. This means they can adapt to the evolving needs of healthcare systems more easily. Additionally, they facilitate smoother integration with other digital health tools and technologies, which is becoming increasingly important as healthcare moves further into the digital realm.
Right. It makes sense. As we rely more and more on technology in healthcare, our systems need to be able to keep pace with those advancements.
And this move towards cloud-based systems aligns with a larger trend in enterprise technology spending. Forrester predicts that spending on AI, cloud computing, and cybersecurity will reach a staggering $4.9 trillion in 2025.
Wow, that's an astronomical figure. It really highlights the growing role technology is playing across all industries, healthcare included.
Absolutely. And as we embrace these technological advancements, it's essential to prioritize responsible data management and security. The more we rely on technology to store and process sensitive health information, the more crucial it becomes to safeguard that data.
Absolutely. Data breaches and privacy concerns are major issues in healthcare, and we need to ensure that these technological advancements are implemented in a way that protects patient information.
Definitely. Speaking of navigating the evolving landscape of technology and regulation, former FDA head Scott Gottlieb has been a vocal advocate for a balanced approach to AI regulation, particularly when it comes to clinical decision support software.
Right. He argues that overly strict regulations could hinder innovation in this rapidly developing field.
His perspective raises important questions about how to foster innovation while also ensuring patient safety. It's a delicate balancing act that policymakers and regulators need to carefully consider.
It's clear that the role of government in healthcare is a complex and ever-evolving issue. On one hand, there's a need to foster innovation and advancement, and on the other hand, there's responsibility to protect patients and ensure equitable access to care.
And this tension is further heightened by political and financial pressures. We've already discussed the GOP's push for deep cuts to Medicaid, but there's also a broader trend of budget constraints and job cuts across federal agencies, including those involved in healthcare.
It seems like the healthcare landscape is constantly in flux with new challenges and opportunities emerging all the time. It can be difficult to predict what the future holds, but one thing's for sure, navigating this complex terrain requires careful consideration of the interplay between technology regulation and the human impact on patients and providers alike. Yeah, it's clear that the healthcare system is facing a whole bunch of challenges, from financial pressures to workforce shortages and evolving technological landscapes. But amidst all these challenges, there are also stories of resilience and innovation and a commitment to improving patient care.
Absolutely. It's important to remember that behind all the headlines and policy debates, there are real people whose lives are directly impacted by the decisions made within the healthcare system. So let's delve into some of these individual stories and experiences that highlight the human side of healthcare.
Earlier, we touched on the story about Havana, Florida, offering those significant incentives to attract a family doctor. This story really resonated with me because it highlights the very real consequences of the physician shortage, particularly in rural areas.
It does. It's a stark reminder that for many communities, access to even basic health care is not a given. The fact that a town has to resort to offering free rent and equipment to attract a physician, it speaks volumes about the challenges they face.
Yet, it also highlights the dedication of those healthcare professionals who choose to serve in underserved areas. It's not always about the financial rewards, it's about a commitment to providing care to those who need it most.
And while some communities are grappling with shortages, others are exploring innovative models to improve access to care. There's an interesting partnership between Centivo and Premise Health that caught my eye. They're launching a primary care-focused health plan aimed at self-funded employers.
So they're trying to make it easier for employers to provide quality, affordable health care to their employees.
Precisely. It's a recognition that employer-sponsored healthcare plays a significant role in the lives of many Americans, and finding ways to make these plans more affordable and accessible is crucial.
That makes sense. It's a positive development and hopefully a sign that the healthcare industry is recognizing the need for more flexible and cost-effective approaches to healthcare delivery.
Speaking of navigating financial challenges, there's some significant news coming out of Massachusetts Mass General Brigham. A major healthcare system is facing a projected budget gap of $250 million over the next 2 years.
Wow, that's a considerable shortfall. How are they planning to address it?
Well, unfortunately, they're resorting to layoffs, which is never good news. In fact, it's projected to be the largest layoff in the system's history.
That's disheartening to hear. Losing skilled healthcare professionals is a loss for everyone, especially considering the workforce shortages we're already facing across the country.
It really is. It underscores the financial strain that many healthcare systems are under, and it raises concerns about the long-term sustainability of these systems as they grapple with rising costs and changing reimbursement models.
Yeah, it's a complex problem with no easy solutions.
And while some organizations face difficult decisions like layoffs, others are finding ways to innovate and adapt. We discussed the Food is Medicine initiative earlier, and I think it's a great example of how healthcare systems are starting to think outside the box and address the broader social determinants of health.
I'm curious to see how that program evolves and whether it can serve as a model for other healthcare providers looking to take a more holistic approach to care.
For sure. It's a promising step towards recognizing that health and well-being extend beyond those traditional medical interventions. And while we face challenges, we shouldn't overlook the incredible advancements happening in areas like AI and digital health. These technologies have the potential to revolutionize healthcare in positive ways, from improving diagnostics to personalizing treatments.
It's definitely a time of great transformation in healthcare. There are certainly obstacles to overcome, but there's also a sense of hope and possibility. As we wrap up this deep dive into healthcare news, it's clear that the decisions made today will shape the healthcare landscape for years to come.
Absolutely. It's crucial for all of us patients, providers, policymakers, and innovators alike to stay informed, engaged, and committed to creating a healthcare system that is equitable, accessible, and delivers high-quality care for all.